So hello, everyone. My name is Iman Khwaja Redig. We are pleased that you could all join us for this week's lecture in Volume 9 of the Know Neuropsychology didactic series that brings you lectures from experts in the field covering different topics each week. This series was created by trainees and early career neuropsychologists, including standing members of the Know Neuropsychology Board, as well as members of the Know Neuropsychology Committee. We would like to thank our 2024 sponsors for their generous financial support of this series. Before we start our lecture, one of the main goals of Know Neuropsychology is to provide free, high-quality didactic content to our audience. Every Know Neuropsychology and Know Neuroanatomy lecture is available on our YouTube channel. Be sure to check it out, subscribe, and like our lectures to get first access to new content. New to Know Neuropsychology is our collaboration with APPCN to bring you learning and discussion questions that are provided with specific lectures content. You can access these on our website and through APPCN. Here are the disclaimers for the series. This training is not meant to replace formal education in neuropsychology, and the views of the speakers are their own. Questions can be submitted via the Q&A box on the lower left of your screen, and a recording of today's lecture will be provided on our website and YouTube channel later this week. Now it is my pleasure to introduce Dr. Alexander Tan for today's lecture titled Executive Functioning Strategies for Neuropsychologists, Organizing Your Professional Life and Maximizing Your Time. Dr. Alexander Tan is a board-certified pediatric neuropsychologist and clinical supervisor at Children's Hospital of Orange County and the director of the Children's Hospital of Orange County's Heart Institute Cardiac Neurodevelopmental Program. He currently serves as the president-elect of the Asian Neuropsychological Association and has held over 30 additional positions of leadership across various neuropsychology organizations, including being a proud co-founder of Know Neuropsychology. Additionally, he has co-authored over 50 peer-reviewed journal articles and scientific abstracts, and has received multiple prestigious accolades, including the APA Early Career Psychologist Achievement Award in recognition of his distinguished impact on the field of neuropsychology. Well, Dr. Tan, we are so excited to have you back here and cannot wait to hear from you. So I will go ahead and stop sharing my screen so you can get started.
Perfect. Well, thank you for that kind introduction. I am going to share my slides now, and just if someone could confirm that you can see my slides okay?
Yes, we can see them.
Awesome. Okay. So thank you to Know Neuropsychology for giving me the platform to share this kind of information. I recognize that the content of today's talk is quite unique. It's not necessarily a competency. It's not necessarily a content area. You're not going to be tested on it in your board exams. But I do firmly believe that it will help you become a better neuropsychologist, as that has been my experience as well. So thank you again to Know Neuropsychology for giving me this platform. So I'm a pediatric neuropsychologist, and I find myself telling many parents of many patients, everyone has their strengths and weaknesses, and executive functioning in particular is often a weakness that comes up. And so I say to them, it might not come naturally to them, so we need to teach them the strategies and the tools. Well, as professionals, we also aren't always really taught any executive functioning strategies as it applies to our professional practice. But being organized does have a direct relationship with saving us time, saving us mental energy, supporting our wellness, and preventing our burnout. So that was really the idea behind this talk. So my quote unquote credentials, as there are really no formal credentials to discuss this, but that there's simply that I've read a lot about organization. I've always been actually fascinated by that as a topic ever since a young age. And I do I do many things and wear many hats in my professional life. And so over time, I've implemented various organizational principles and systems that have really helped me. And so I want you to just think of today as me sharing different parts of my process with you and giving you a window into my professional practice. And really, I guess, a window into what my mind looks like, which you may find strange. I also want to share a couple disclaimers. Firstly, my goal is just to share concepts and strategies that you can implement into your professional life, but only if it's helpful for you or if it works for you. So implement what makes sense for you. The goal is always to increase your efficiency and your wellness. It's never to decrease it. The other significant disclaimer I do want to say is that you are going to see many pictures today or images of things that resemble tools that I use in my own practice. These pictures have all been heavily edited, so they're just examples. I had to heavily edit them to remove things like PHI, confidential data, institutional data, content of internal conversations, etc. So please remember that the images that you're seeing are all very similar to what I use, but everything on there is heavily edited. Okay, so just jumping in, these are some of the topics that we're going to cover today. So I want to talk about categorizing and decluttering our professional life, creating a centralized control center, integrating visual cues and time savers into our workspace, implementing processes to guarantee closed loops, creating time by eliminating, automating, and delegating, and operationalizing our bandwidth for new commitments. So hopefully these concepts are going to be helpful to you today. So let's jump in. So categorizing and decluttering our professional life. So I think probably many in the audience are trainees and some might be in their practice. I myself am in the early career phase, and so I have found that it gets very complicated very quickly once I transition from training. All the different hats that I have to wear just at Chalk alone. And so just to mention that today's talk, I'm going to be focusing pretty much explicitly on my practice at Chalk and not necessarily activities that I'm involved in outside of my main practice. But you can see just here, it's just kind of an overwhelming list of roles that I have to play, right? I'm a neuropsychologist, so I do evaluations here. I'm also a faculty in the department, and so I have to follow various administrative policies, and I have to take care of different requirements and attend different meetings. I am a supervisor in our training program. I either am or have coordinated or been a lecturer for various departmental seminars. I'm a representative for our neuropsychology training program externally. I've participated in our departmental mental health education program. I direct our cardiac neurodevelopmental program. I direct the clinic, the embedded clinic. I am a PI of our research study. I am an institutional representative to national multi-site research. Um, if you're overwhelmed just hearing about it, I'm overwhelmed doing it. So I just briefly kind of read through that just to mention, these are just all the different hats I have to juggle. And so it gets very complicated. And so, I have, as I mentioned, read various organization books and things of that nature. And a concept that I always find helpful is something that the Marie Kondo series kind of mentions, which is really learning how to declutter and learning how to categorize. And so let me just take all these roles and distill it in the way that I have. So the Marie Kondo method, we categorize and we declutter. And so this is, for me, I'm going to show you my framework that's first of all conceptual, just a framework that allows me to stay organized in my mind and makes everything much less overwhelming. But also this is a window into the file system that I use. And I do believe that if you don't have a file system that's dependable, you definitely need to start one. The most common ones are Dropbox, Google Drive, or many institutions such as mine provide a personal drive for us to use, which that's what I use in my practice. But firstly, what I have done is at each level, asking myself, okay, what is the minimum number of categories to kind of encapsulate everything that I do? And so for me, all those different roles that you saw on the last slide can really be divided into three aspects of my practice. It's either my clinical practice, my involvement in training, or it's my involvement in directing the cardiac neurodevelopmental program here. I kind of think of it as an organization. So if you've ever been involved in a leadership level with any kind of organization, you always kind of have to think, okay, what are the major committees, right, that are necessary to oversee all of the different initiatives and activities that the organization's involved in. So, so for me, these level one categories are like my major committees: the clinical committee, the training committee, and the cardiac neurodevelopmental program committee. Okay. So then as I move to level two, and again, this is both a framework in my mind, but also this is actually my framework in my file system, my digital file system. So you can kind of see I have three folders at level one, and then these are my folders at level two. So for my clinical, everything can be broken down into either administrative things or roles, or my actual evaluations that I administer here at Chalk. For training, everything can be divided into either things related to supervision or related to education, including the seminars, or related to the general fellowship at large, in which I have kind of a representative role and coordinating role as well. And then for my cardiac program, there's the clinical program and there's a research program. So these are my level two, both in my mind and in my file system. I think of these kind of like subcommittees. And sometimes, sometimes there may need to be like a temporary task force or something in an organization. And so sometimes I need just like a temporary placeholder of a folder. But this is kind of my overarching structure. And then at level three is where it starts becoming very individualized, right? And so hopefully you can see my mouse hovering over my screen. But these are just some examples. Under my evaluations folder, I've kind of divided it into these 6 different aspects of the evaluation: scheduling, intake, testing, feedback, report, and billing. Those are kind of all the things that I need to be thinking about in terms of my evaluations. And so that's kind of how I've divided things there. Under my education folder, I've just divided it by the different seminars and education programs that I'm involved in. And for example, under the research program, I have my research at Chalk, I have my research nationally, and I have a folder for all the literature that I like to keep to inform my research as well. And so I'm going into this detail, hopefully to illustrate that the sign of any organized file system is that you should be able to know exactly where something is without needing to waste any time searching for it. Okay. And so many times in meetings or when I think of something or there's a task, it's like, hey, I need to find the schedule for this seminar, right? Because I need to remember when I'm going to be presenting. And so I know that it's going to be under training, education, and then maybe the advanced neuropsychology seminar, right? Whereas if I need to find, oh, what is that feedback a resource that I have for feedbacks that I like to give to patients, I know it's going to be under clinical, evaluations, and then feedback, which is where I do house all of my resources that I like to share with patients as well. So this is something that I do feel a lot of people waste a lot of time on, which is searching for things where when they don't know exactly where it's located. And so for me, I always think of it as if I know exactly where things are, then I feel pretty organized myself. And these are systems that once we implement, we do have to somewhat maintain. And so, for example, for me, once a year, I go through and I declutter. So I discard old versions of things that I no longer need. I delete categories that are no longer relevant. I consolidate items that maybe have already been completed or resolved, or I won't need to participate in again. For example, I no longer participate in the mental health education program here. And so that's already been consolidated into kind of a folder that's just kind of historic things that I've done. So this is hopefully just a kind of an example of how we can really kind of declutter, even just in our mind, kind of everything that we do and simplify it. I'll tell you that thinking about it this way makes me feel a lot more in control of all the different hats that I'm wearing throughout my professional practice when I can just distill it into these few categories, and everything that I do can be hung under one of those categories, so that nothing feels too overwhelming. Okay. And so once you've done that, it's helpful. For me, it's been helpful to have something like a centralized control center, just some key things that I need to kind of oversee everything that I do. And so I find that these are the different big things that we need. And I'll just tell you, I keep things very simple. So I know there's a lot of like apps out there. I know there's a lot of like project management tools. I just find that I can do everything I need to do by using a combination of Microsoft Word, Microsoft Outlook, and Microsoft Excel. So literally, I don't have fancy things that I use. I'm not very techy actually, so I don't really enjoy learning how to use new and complicated tools. I just kind of keep everything simple. And so I find that the big things that we really need to make sure that we are keeping track of, firstly, is just updated information and our tasks that we need to make sure that we're tracking. So I do everything on Microsoft Word for that. We obviously have a schedule. I know that there's no way you made it through grad school without finding some kind of scheduling system for yourself. And so a calendar, which I use through Outlook. And then I also use Outlook for all of my communications, emails, etc. And then some of those level one categories, right, might need some kind of overseeing system as well. So for me, my clinical major system is a patient tracker that I use. I'm going to share an example of that. That's on Excel. For training, I have a training calendar that just kind of has the overarching, dates and kind of training major events throughout the year, throughout the training year that I need to be tracking. And then for my cardiac program, I do have a clinic tracker that tracks all the different patients that come through our program. And I use it to also track a lot of different information, as well as link that with their research data as well. So that is also on Excel. So these are some of the different major systems that I use to make sure that I kind of have a control center that oversees everything. And so I'm going to share a few examples. So again, heavily edited images and a lot of things have been removed. But just this document kind of shows, this is the Word document that I use to keep track of everything in terms of my information and my tasks. And you'll see that this is kind of my workflow document. It matches that organization system that I use. So clinical being one of the three major level one categories. If you were to scroll down on this document, you would also see training, and you would also see the cardiac neurodevelopmental program. Under clinical, my level two categories, here is administrative, and here is evaluations. So here is all the information that I need to keep track of. So for example, I need to keep track of the schedules of the different meetings that I need to be involved in. These are all of my administrative items. You'll see here that I have different big picture tasks that I need to keep track of, as well as the dates that they are due by or that they're taking place. You can see here on the right, I have for each of those different level three categories under scheduling, just different information. For example, who do I communicate with in relation to various kinds of administrative tasks? What are the up-to-date, what's the up-to-date process if I need interpretation? What is our up-to-date no-show policy? What is the content of our standardized documentation? What are some of our policies? What are some of our codes that we need to be using? And so whenever I have new information that I receive either from my supervisors or from the department, then it all goes on here. So I always have one document that has all the high level up-to-date information that I need to do my job. And so if I get for example, an email comes in, hey, from now on, effective immediately, this is the person that you need to contact if you need this kind of help administratively, then I update this part of my document so that it's always the most up to date. And so I find myself just kind of able to keep track of everything I do professionally just from this one document alone. And again, I continue to update every time I update on here, either new information or as I complete tasks. You'll see here they're kind of arranged in order by deadline. Whenever I complete a task, then I update this so that I either remove it because I finished it, or I move it down if there's a second part that needs to be done later. But this is kind of always in order, so I can see coming up, okay, hey, I'm actually going to be speaking at this seminar very soon. So that's kind of at the top of my mind. I need to make sure I provide this update administratively pretty soon as well. So kind of these are the things that I'm prioritizing right now, whereas some of these things down here are I can prioritize later. I'm going to talk more about email later on in this presentation, but for now, just also want to mention, you can kind of see again, I have my high level categories. So clinical and clinical, if you remember, is my evaluations and my administrative training. I have a folder and my program development and research. And I just have here an example of sometimes, as I mentioned, there are like temporary task forces or things. So for example, I am going to be presenting at the upcoming AAPDN conference. And so I get a lot of emails related to just making sure that I'm, kind of have to fill out forms and have all these different tasks. And so all those emails are going to this one kind of temporary folder. And then once I complete my engagement there, I'll delete that folder as it's no longer needed. I will talk more about my inbox and these different colors and things like that later. But that's just kind of demonstrating that my my Outlook is another kind of big picture system that I use that's organized in the same way as my conceptual framework. Okay, this again, heavily modified. None of this is real data, but just showing you an example of the patient tracker that I use. And so just to give you a little orientation, here's kind of the month. I have here the patient data, which obviously has been removed to protect PHI. I have their diagnosis, so I can see at a glance kind of what the presentation might be, any notes that I need to make sure to remember. And then I'm keeping track of, for example, the testing date, the intake date, the feedback date, the date that I submit the report. And Excel is very powerful. You can use Excel formulas if you take some time to learn them to do a lot of different things. These are just some simple ones where I'm just calculating my report turnaround time. Again, these are all fake numbers. And then my calculating kind of productivity numbers as well. I'm going to go into a little bit more detail about how I use this later, but just to give you an overarching orientation, this is kind of one place where I have everything related to patient care. And so I have here in one location all the different patients on my schedule and tracking on, did I complete intakes, testings, feedbacks, reports, et cetera, et cetera. So the goal behind kind of these overarching systems in the control center is just to make sure we have one location to track on all high level information that we need to be successful at our jobs. Okay. So I'm going to spend quite a bit of time in this section here because I do think this is where we can make a lot of improvements to our workflow. I'm going to talk about both of these together, integrating visual cues and time savers into our workspace, and then implementing processes to guarantee closed loops. Both of these are really important for two reasons. For the first reason is I find that when things are out of sight, they're also out of mind. And we really shouldn't trust ourselves to keep everything in our memory. We really, I think, benefit from, or I really benefit from having a lot of visual cues that just kind of automatically remind me of things I need to be doing, or when like upcoming things that I need to be paying attention to. As far as well, closed loops, to me, that's really important. Um, I often find that a big inefficiency in systems is not guaranteeing that a loop is closed, either on a task or action item or on an email communication. And so I have implemented personally processes to guarantee closed loops as well. I say this in the kindest way possible, that I never trust someone else to ensure that something gets closed. And for a lot of reasons that aren't anyone's fault, but we're all human. We all make errors. We all make mistakes. We all forget things. Sometimes we drop the ball. And so I just find that if I can implement some systems to guarantee that and no one, including myself, drops the ball on anything or forgets anything, I find that to really help me in my professional practice. So I'm going to give some major examples of how I do this in my day-to-day. So this is a somewhat edited version of what my desktop actually looks like. And you'll see here that my desktop is actually in itself an organizational tool that I use. And so let me orient here. On the left, these left two columns are just things that I can't delete or things that have to be on my desktop. But this third column here is actually my, what is this, 10 most frequently opened documents. And so from my desktop, I actually have immediate access to the most common things that I need. So that workflow document is right here. That activity report, that kind of patient tracker is right here. My report templates that I need very commonly are here. My score table templates, my tracking document for my clinical, the cardiac neurodevelopmental program, the kind of a major tool that we use for our research, that neuropsychology training calendar that I mentioned. So you'll see that this is kind of where I can access like all the major things that I need at any point. On the right here, you're going to see this is actually my patient queue. So these are in order. So I have here clinical, right? Here are my high-level categories: clinical, training, my cardiac neurodevelopmental program. So from here already, I can access that part of my file system for when I need something. Okay. And then on the right here, this is my report queue. So these are my reports in order that are due. So I have these two reports outstanding. I have these two reports outstanding as well, but also score tables that I haven't maybe integrated or finished scoring. If I had other documents related to the case, I would maybe put them, here. But you can see here that this is actually very powerful for me. I can see exactly at a glance that I have 4 reports that are outstanding. I can see the order of them, and so I know exactly which reports I need to prioritize. I know that if this queue ever gets down to here, I know that I'm in a report hole and that I need to really prioritize taking myself out of it. So at a glance, I can see exactly what my clinical demand is in terms of reports, just kind of from this visual organization that I've implemented. Same thing here. So for example, training. I have here access to the scheduled seminars, which I need to check pretty often if I'm involved in them. And then you'll just see here some high-level tasks that I've been needing to do, and they were kind of in order. At the time that this picture was taken, they're in order of kind of deadline. So there was a major application I needed to submit for something that was coming up, and then there was this KnowNeuropsych talk. So the slides are here. And then there's another talk that I'm giving after this. These slides are here. So again, at a glance, I can just see, hey, these are the major things I need to be working on and in the order of which they are due. So that way I know exactly, again, at a glance, where I am in terms of these different kinds of tasks. Same thing up here. So this folder allows me access to the folder in my database. And then these are different things that I'm working on in the order in which they need to be prioritized. So here are a couple manuscripts that I'm currently working on. Here is I'll just say a project or a kind of a task that needs to get done, another task that needs to get done, etc. And so they are in order of priority. So all the major things I need to be making sure that I'm keeping track of are right here visually for me to remember. And they are, again, in order of priority. So this desktop, for me, a well-organized desktop really allows you to, at a glance, use it not just as a place to put things, but actually as a way to give you information at a glance that's important to make sure that we're keeping track of everything we need to do and that we are staying on top of deadlines and prioritization. I'm going back to this. This is the same picture that you saw earlier, but an example of how I've implemented processes to guarantee closed loops. Anytime I have something that is going to, for example, happen regularly, so every month I need to email an update, every time I do the task, so this one is due at the end of February, then I will update the date for the next month and move it in the corresponding position on this task list. So this guarantees that I always remember to do it. And here's a little secret, sometimes we're in kind of staff meetings or different kinds of meetings, and I've had people ask me, oh, how do you remember everything that we haven't finalized or haven't resolved? Well, I actually just put it right here. So this is like, for example, staff meeting. The upcoming staff meeting is going to be on March 1st. And I have here, obviously it's blocked out, but kind of the different conversations that have not been resolved or that we need to continue to track on or that we need to discuss next time. So I just keep an updated list here, and every time we have a meeting, I update this list. And so this makes sure that, again, the principle of I'm just relying on myself to make sure everything is covered. And so if there's something that I'm not tracking on and no one else is tracking on, then it's very possible that we start a conversation in a staff meeting and then we just never follow up on it because no one's tracking on it. And so this is how I personally am tracking on everything that's being discussed, even at a group level. You'll see the same thing for a training meeting I'm involved in. And these roundings are individual with supervisors. And again, so just keeping track of everything that I want to discuss with them or things that conversations that have not been resolved yet. So back to my patient tracker, I use a color system actually as a visual cue for myself. So this is ignore the bottom part for now, but the top part is what you saw earlier, but you'll see here that actually green, yellow, and red all mean things to me. So for me, red means that it has not been done. So these 4 reports and this example have not been done. I have a date there that's kind of a deadline, kind of a institutional deadline. And then if they are yellow, it means that I've done it, but I haven't submitted the documentation. So for example, I've done the testing, but I didn't submit the progress note for it in our medical records yet. And then if it's green, it means that I've actually submitted everything, so it's completely resolved. And so again, this is a color cue, which is just a visual cue that I've implemented here that really allows me to see at a glance, okay, where are the things that I have not, where are the things I haven't done? Where are the things that I've done, but that I haven't actually submitted the documentation? And what are the things that have already been resolved? This ensures, again, that a closed loop on everything, on all patient care. So I'm never going to forget to submit a note or never going to forget about a feedback, etc., because everything is here. And I've implemented, again, that visual cue for at a glance, knowing exactly where I stand in terms of patients that I've seen and what the outstanding clinical requirements are. Okay. On the bottom now, this is actually, if you were to kind of scroll to the right on this top document, this is what you would see. So I actually use this, again, these are all fabricated numbers, but I have Excel formulas tracking things live for me. And so at the end of every month, I have something calculating my average report turnaround time. I have something calculating my productivity requirements. And this is kind of within the month. And then over here, this is year to date, so cumulative totals. And the reason why I do this is because this is kind of how my productivity is measured, right? So my boss is looking at, are you meeting your productivity requirements? And I know that this is how they're being calculated. And so I myself am also doing a calculation. Why? Because I want to make sure that I am relying on myself for all the to know, am I meeting my clinical responsibilities? Am I meeting my requirements? How well am I doing on turning around reports? And then sometimes, maybe we get our reports back that others are tracking, and there's inconsistencies. And it's been really helpful for me sometimes to have, well, this is what my numbers say. Let's see why the numbers are different. And sometimes it's because, oh, didn't realize that maybe there was this reduction to my productivity requirement, maybe because of PTO or something like that. So it's been very helpful for me to be able to track things. I also have something that's on the right here tracking exactly how many in that year, how many evaluations I've completed. how many of my trainees have completed that I'm supervising, how many were incomplete, maybe because of no-shows. And so I can see at a glance kind of what my makeup looks like as well. And so these are all just implementing processes to increase efficiency, right? Because sometimes I need to keep track of data because I need to meet certain demands or requirements, or because I need to report things to supervisors, et cetera. And so this allows me to just have something that's doing the work itself, right? It's just live updating. And then I can at any time, if my supervisor says, "Hey, how come your numbers were low this month?" Well, then I know exactly what my percentage of no-shows were. Or if my supervisor asks, hey, like how many, just because they want the information, like how many evaluations did your fellow complete? Well, I have that number here. So I just, I don't build these things for no reason. I just kind of implement things when I find myself needing to give that information. And so that's why I kind of implement things that can automate those processes so that I don't have to spend time on it every time. One more example in my email. Again, I use the green, yellow, red for everything. So um, I find that email is kind of a place where loop balls get dropped a lot, and things don't get followed up on. And so this queue is actually what I use. So this is my inbox, and so my inbox. Um, I delete everything that's resolved, or I move it into a folder if I need to keep it for some reason. But this inbox only has things that I need to be tracking on. And so when I open my email, I know exactly what demands my attention. I personally don't like the idea of having this also include, kind of emails that I've already read, but I've saved for later, etc. Because for me, I want everything to be a visual cue. So at a glance, I know exactly what things I need to respond to in my email. And green, yellow, and red all mean something. So red for me means that the ball's on me. So something that I need to do or respond. So these are some emails that I myself need to respond to. Yellow means it's something that I need to do, but I'm waiting on someone else first. And so this is an email thread that I can't do what I need to do until someone else does it. And so that's marked as yellow, so I know that. Green is something that I don't need to do anything more, but I do need to wait for it to be resolved so I can guarantee the loop is closed. So for example, I've asked someone for something. Maybe I've asked the front office to give me a document, and I label it as green because once I get the document, there's nothing else I need to do, but I do want to make sure that it's followed up on. And so if it's green, it means I'm waiting for the loop to get closed. I'm waiting for it to be followed up on, but I don't have to do anything further. I use these folders on the left to put things that maybe are highlighted green or yellow. I never put a red item in these folders because again, I find that if it's out of my sight, it's going to be out of my mind. So everything in my inbox is something that either is I need to do, or it is something that doesn't necessarily fit into one of these categories that I need to be tracking on. Um, this is just a secret. This blew my mind. And again, I'm not techie, so maybe everyone already knows this. But when I send an email, you can actually move a sent email into your inbox. And so that was one of the biggest changes to my kind of ensuring that all loops are closed, is because sometimes I send an email, but then I forget that I send it, and then it never gets followed up on. So whenever I send an email that I'm waiting on something to make sure it gets resolved, I move the email from my sent folder into my inbox or into one of these categories. And that way I'm keeping track of something that was something I initiated, like a request that I initiated. So again, these are all just different examples of how we can implement visual systems and how we can guarantee that loops are closed in different aspects, whether it's our email, whether it's our patient care, whether it's kind of big picture things that we need to be tracking. Okay, I am mindful of the time, so just going to continue quickly here. So creating time by eliminating, automating, and delegating. So I find the focus funnel method to be quite effective. And what the focus funnel method is whenever you have tasks, first they go through this funnel. Can you eliminate them? Like, is this something that I can live without? Then, if you can't eliminate it, can you automate it? Is there a way that you can, systematize it or automate it? If you can't automate it, is it something that you can delegate? Is it something that I can give someone else to do? If not, then you're going to have to do it, right? And if you want to do it, you either do it now and you concentrate, or if you're going to do it later, then you're going to move it to the top of this queue later, but making sure that you track it, right? And for me, if I don't do something now, I always make sure it's recorded somewhere so that I make sure that I follow up on it later. And so I find that this is very helpful. Of course, sometimes eliminating is possible if we just ask ourselves some simple questions. Is my involvement necessary? Is my input necessary? And a question that I ask myself a lot, does this task require my best work? I work with some families where I'm trying to explain to the parents that average is a good thing for us, right? Not everything is going to be above average or exceptional, but if it's in the average range, that's a good thing. And I actually find that we don't follow this principle ourselves. A lot of times we feel like everything we do needs to be in that above average to superior range. And I have found over time that that's not necessarily the case. And so sometimes the task, as long as I'm doing the work adequately, sometimes there are tasks that maybe I can't eliminate completely, but I can save a lot of time by remembering that it doesn't need to be my best product. Automating is where I find I find that there's a lot of ways that we can automate things. So my patient tracker was a good example of that, where there's just like live things, live updates on kind of different metrics that I need to keep track of. Report templates. I spend a lot of time actually on my report templates, so that for different patients, it actually goes much faster. I have things automated in my score tables to automatically present, if I input a score, it automatically calculates the percentile, the score descriptor. Some things where are automated scoring, I just put the number in and it scores it for me. We can use bookmarks to our advantage. I have a file that's literally just email lists. And so it's, for example, groups of people that I need to email often, whether it's something in my kind of in various leadership capacities, or whether it's kind of internally in my institution. And so there's just an Excel sheet that just has the list of emails. And then I just copy and paste that when I write an email, and it goes to everyone that it needs to go to. And so, of course, there are some things that already have like a email list or group, but there's a lot of groups of people I need to email that don't really have like an embedded, email list or group. And so I just have my own list, and I just update it as personnel change. But the email list allows me to automatically, instead of hunting down all the different emails, it just allows me to automatically have everyone I need to email to. So again, there's a lot of different ways that we can automate things so that things are just more efficient for us. And then, of course, delegating. I find that delegating, of course, is more of an option the farther you are removed from training, but sometimes there are things that maybe make more sense for support staff. And one thing that I find is, any of this, taking time now can save you a lot of time in the future. And for me, advocating for supportive resources is always something that I'm passionate about, because in a way, it's saving me time, down the road once that advocacy is successful. Sometimes we can delegate to trainees or other team members. I always say that if I'm doing that, I think of it as collaborative delegating. So I'm not just giving someone something because I don't want to do it, but I am giving someone something that I feel like it's helpful for us to work together on, and that I'm making sure that I'm doing my role. And so it's fair for the person I'm delegating to also have a role in the project as well. Once if we can't eliminate, automate, delegate, if we have to do it, there is this kind of like principle out there. It's called the 2-minute rule. And that principle is, if you can do it in less than 2 minutes, just do it now. And the reason why, and I kind of follow that rule, and the reason why is because I find that if it's going to be really fast, it's more efficient to just do it now than to have to like use mental energy to keep track of it, to do it later, when it's something that can be done so quickly. So I tend to just have a do it now approach when it's something that I find that I can just do really quickly in between meetings or in between tasks. or in between patients or etc. Just an example of how we can kind of work on automating. So this is like an example of my behavioral observation section on my report template. And you can see I've implemented drop-down menus. So I can just click, and then that just automatically fills in that information. So again, just finding ways that we can use the tools that we have. And I'm not techie at all, so this is just Microsoft Word, but use the tools that we have to make things faster. Instead of entering information in manually, I can just click it from a drop-down menu. This is not to spend too much time on it, but I did mention that I have a tracker for all the patients that come through our cardiac neurodevelopmental clinic. Well, a lot of times I have to report things to other people. I have to report what our volumes are. I have to report what our how many referrals we're getting, how many patients we're seeing, et cetera. Again, these are all fabricated numbers, but you can see here that this is all live updating from the patient tracker. And so I've delegated to some support staff to enter in the information that needs to be entered in manually on the patients. But then once it's entered in, this is all live updating. I can see exactly at a glance, and I can report to anyone any information they need about referral volume, clinic volume by quarter, by fiscal year. I can see at a glance what percentage of referrals have been completed or have been are not completed or are scheduled or on the wait list. I can see here exactly how many referrals are being made by which cardiologist. So again, just ways that we can automate or implement systems that just keep track of things so that every time someone asks, I don't have to spend the energy and time to dig for that information. Now the information is always accessible at my fingertips. Okay, and then in the last few minutes, um, I just find that sometimes it's really helpful to operationalize our bandwidth for taking on new commitments. And I know it's like we're people that always want to say yes to everything. And so over time, I have found that I really like to ask myself some questions. What are my major pillars? For me, my major pillars are clinical work, training, research, and service. And so I always like for those pillars to be somewhat balanced. And so if there's a new task or a new role, does this really fall under one of those pillars? If not, then I'm asking certain questions like, well, what are my goals? Will taking this on help me advance me toward those goals? Or is it actually not going to be helpful? Sometimes it's what are my values, right? Will taking this on be compatible with my values? Sometimes I do things that are gonna take time and they might not help me reach any goals, but because I have a certain value of maybe being helpful or mentorship is important to me, I'll take the time to do something, even if it's not necessarily quote unquote helping me meet goals or falling under pillars. And do I have enough time, right? Will taking this on put me above the bandwidth in terms of the limit I'm willing to spend on time? And so I've actually kind of operationalized it, and this isn't my document, but it's just kind of a template taken from what I have, where I actually have my pillars here. I have the different roles that I have to play under those pillars, and I actually have the hours per week that it takes. And in this way, I can see what the balance is of those different pillars in terms of how much time things are taking, and I can see what the total number of hours are. And I set for myself a limit, like I don't want to spend more than X number of hours on just work and professional stuff. And so if you give me a new role or propose a new role, I'm gonna put it in here and see does that take me above my time limit? And if it does, then that's where I have to really think about saying no. I'll give you an example of this. So here is kind of where I put goals. I break it down into early career, mid-career, late career. But for example, an early career goal of mine was becoming board certified. And so sometimes there were things that were going to take up extra time, but that were going to actually help me in the long run. So there were two different seminars that I was asked to maybe coordinate or develop. So one was a board certification preparation seminar, whereas the other was a seminar that was for interns and practicum students. And so because of my kind of calculations here, I knew I only had time for one of the two. Well, technically, I didn't have to do either of them, but because the board certification preparation seminar helps me to reach my goal of becoming board certified, then I took on that one. And it also meets some of my values and helping to, mentor others in their journey of becoming board certified. So I took that on, whereas I said no to the other responsibility, which would have added extra time, but not necessarily helped me much in terms of meeting my goals, uh, or um, or being compatible with my values. And I do have here my values and their current balance. And that's because we have a lot of values that are outside of our professional life, right? So of course, I always value being helpful to others. And if I had unlimited time, then maybe I would also say yes to coordinating a seminar that was helpful to the interns and practicum students at my department. But I found that there are these other values that I have, right? Spending time with family, or certain hobbies that bring me kind of help me to relax and reduce burnout. And so the balance of those values is really important to me. And sometimes I think of my values also as needs, so I have a need to, make sure that I'm spending time with family. Well, taking this on, even if it meets a value of mine, is it going to upset that balance that I've found in terms of juggling my professional life with my personal life? So these are just, anyway, some examples of how questions that we need to ask, but actually putting it down on paper, actually operationalizing things, and so if I can see everything at a glance, it really helps me to know, should I say yes to this new commitment, or do I need to say no? Okay, so hopefully this has been helpful just in terms of giving you a window into different systems that I've implemented, or strategies, different kinds of tools. I hope that there's something from today that you can take with you, that will help you to become more organized or efficient in your own professional life. And at this point, I'd like to open it up to any questions.
Thank you so much, Dr. Tan. That was a wonderful lecture. I really like how you organized all of the different categories and were able to provide concrete examples, because I think this can definitely seem overwhelming on top of everything, but knowing how you structure and providing different examples of those structural pieces is really important. Something that came to mind, and I think it's really nice that you incorporated that, is your section on operationalizing your bandwidth for new commitments and really focusing on those values, because I think what you're speaking to is, we have our professional lives and we have our personal lives, and we are a whole person. So it's important to make sure we're balancing our personal and professional values and needs as well. So thank you for speaking to that. Especially, I think that's a good model for trainees to hear before they get into their career, so they can start to put those things into practice. We have some questions here for you. So one of the questions is very good. When do you take time to do upkeep of these systems? Is it protected part of your working day, or do you do it outside of work?
Yeah, that's a really great question. I so certainly, there's no protected time for this kind of thing, but in a sense, no, but in a sense, yes, right? So in many of our jobs, like, we're given a certain amount of time in a week to just handle clinical stuff. And part of handling the clinical requirements is keeping track of our patients, or, making sure that we're providing all the documentation. So in a way, it's even though it's not protected, it is, part of our responsibility, right? And so in terms of upkeep, it really depends on what system we're talking about. For some things, I just keep it up to date. So my desktop is always up to date because I'm constantly finishing reports. I constantly have new reports. So I just keep that queue up to date every day. My task list, I kind of look at once a week, just to make sure that I am tracking on anything that needs to be done within the next week or 2 weeks. My patient tracker, I am updating every time I do something related to my patient care. So if I submit that note, I turn it to yellow. If I do it, I turn it to yellow. If I submit the note, I turn it to green. So in some ways, those are all things that I'm just maintaining regularly. Certainly, like the bigger picture things, like my file system, that's like once a year. But I find that and that's that quote in the beginning of my presentation, that if we just take a little time to implement these systems and keep them maintained, we save a lot of time throughout the course of our week. There's a lot of time that's wasted on looking for things, a lot of time wasted on trying to remember if we've done something or not. a lot of time wasted. And sometimes because we don't know what's coming up or can't see at a glance what's coming up, we actually don't prioritize our time very well because we don't have all of those different responsibilities kind of in front of us for us to holistically see. So it depends on the system, but in general, I keep things maintained as just part of my practice now, and I just find that it's very easy to maintain it just because it's just part of the system. So in the course of my patient care, it's just part of my checklist for a patient. Not only do I submit the note, but I change the color on my tracking document. And so everything is typically maintained pretty easily. It doesn't really require much extra time beyond a few seconds, but saves a lot of time in terms of keeping track of what I've done.
Absolutely. Incorporating that into a habit in real time. Definitely. Another question we have is, someone mentioned that they think a big area of growth for trainees is becoming more efficient with report writing. And they were wondering what specific recommendations you have for making report writing as streamlined as possible.
Yeah. So there's not a one size fits all answer here because I think different supervisors have different values when it comes to, or styles when it comes to promoting the growth of their trainees' report writing skills. I find that I share my template with my all of my trainees. I will note that I typically supervise fellows when they're first starting, so they're kind of in their first rotation and they're kind of like transitioning to independence. And so for me, it's really helpful to give them that template so that they can learn to work from that template. And so, for example, in my template, there's like a recommendations bank that I use. There are different samples of how I describe certain domains of weakness. So I spend a lot of time on my template, I'll be honest, and in doing so, I save a lot of time when I write my own reports because my reports I can write very quickly just because of how much I have in my template. And I find that it helps for the trainees. Now, I don't like when I share my template with trainees, I certainly cut out certain things that I want them to learn how to do themselves. So I if I want them to learn how to write certain sections from their own, develop that skill themselves, I don't necessarily include that. But sometimes I include some examples so they have some models to work with. Another supervisor might think, actually, I want them to, really just develop their own style, and I don't want to give them, I'm just going to give them a bare bones. These are the sections, and they have to fill it in themselves. And so it just kind of depends on the stage of training. Maybe that's good for a second year fellow, but I find that that transition from internship to fellowship, a lot of that structure is really helpful for them and makes it a lot less overwhelming and improves the efficiency of their report writing. If there are some things that like we don't feel like it's helpful for their training for them to be wasting a lot of time on, then I just include it in there in my template. So for example, under in my report template, I just have a list of the most common diagnoses that I'm making and their ICD-10 codes. And so I don't feel the need to have my trainee go and look up, that's an easy thing to do, look up codes, but I just have them all there so you can just keep the diagnoses that are appropriate. And then that will speed up that part of the process. So different things like that, again, the recommendations bank, they know how to decide what recommendations are applicable in different situations. And I still want them to individualize to the patient, but I don't feel the need to have them, kind of dig through different, kind of like resource banks of recommendations or kind of find their own things when I've already done the work in finding certain community resources or things like that. So it just kind of depends, but those are some ways that I think we can just help provide structure, examples, modeling that can help them to really become more efficient.
That's very helpful. Thank you so much. And thank you for your time and sharing all this information that you've gathered to help model these awesome organizational strategies for us as well.
Yeah, you're very welcome. It was a pleasure.
Take care. Thank you. Bye-bye.